Be sure to have all of the following items before you begin: 1 multiple dose vial of progesterone in oil, 1 syringe, 1 long needle for administration, 1 needle for drying up the medication, alcohol swabs, sterile gauze, safety container. Check that the progesterone in oil is clear. Do not use the solution if the solution is cloudy or contains particles. Wash your hands with soap and water and dry thoroughly. Make sure you are working on a clean, flat surface. If using the vial for the first time, use your thumb to flip the protective plastic cap off of the vial of progesterone in oil. Wipe the top of the vial with an alcohol swab each time you use progesterone in oil for injection. Remove the wrapping from the syringe and long drawing needle. Twist the needle onto the syringe. Carefully pull or twist off the needle cap. Draw air into the syringe by pulling back the plunger to the milliliter cc marking that you have been instructed to take. Place the vial of progesterone in oil on a hard, flat surface. Carefully insert the needle through the marked center circle of the rubber stopper into the vial. Gently press on the syringe plunger. This will allow the air to enter the vial, which makes withdrawing the solution easier. Without removing the needle, invert the vial and slowly pull back the plunger as far as needed to withdraw the milliliter or cc dose of the progesterone in oil that you have been instructed to take. Make sure the tip of the needle remains in the liquid by slowly backing the needle out of the vial as you withdraw the solution. You will only be using a portion of the medication for each injection, not the entire vial. Remove the needle and syringe from the vial. Recap the needle and remove the needle by twisting it off the syringe. Discard used needle in your safety container. Remove the wrapping from the other needle for administration. Twist the administration needle onto the syringe. Carefully pull or twist off the protective needle cap. To remove any air bubbles in the syringe, point the needle upward and gently tap on the syringe. When all bubbles have risen to the top, slightly press the plunger until a small drop of solution appears at the top of the needle. Choose an injection site as directed by your healthcare provider. Common sites for intramuscular injections include the hip, upper outer quadrant of the buttocks, and the outer area of the mid-thigh. For this injection, the upper outer quadrant of the buttocks will be demonstrated. Clean the injection site with an alcohol swab and allow to air dry. You should alternate injection sites each day. Hold the syringe in your dominant hand like a pen or pencil. Use the thumb and index finger of your other hand to gently spread the skin at the injection site. Insert the entire length of the needle in a quick, dart-like motion at a 90-degree angle straight in. Hold the barrel of the syringe in your non-dominant hand and very gently pull back on the plunger just a bit to check for blood. Do not pull forcefully back on the plunger. If there is no blood, push the plunger in a slow, steady motion until all the medication is injected. If there is blood in the syringe, remove the needle, change the needle, and start the injection again at a different injection site. This does not happen very often and is not a reason for concern. Once the injection is completed, gently withdraw the needle and apply pressure to the injection site with a sterile gauze pad. Once your injection is complete, dispose of the used needle and syringe in your safety container.